Hello everyone. This is the ABG series scenario 7 brought to you by the Medicine Project. Let's have a look at this case. So, 54-year-old male was brought to the emergency with complaints of recurrent vomiting even after drinking water and an inability to pass stool since 3 days. The patient has no significant medical history but had a history of laparoscopic cholecystectomy done 4 years back. On examination, BP was 110 by 70, pulse was 100, abdomen was diffusely tender, and bowel sounds were absent. A bedside ABG revealed the following. So pH was 7.56, PaCO2 48, bicarbonate 40, sodium 138, potassium 2.9, and chloride 88. So let's describe this ABG disorder and see the management of this patient. Okay, so this patient is a case of metabolic alkalosis with partial but appropriate respiratory compensation. The compensation is partial in the sense that the pH is still alkaline and out of the physiological limit. But based on the correction formula that I have mentioned in the comment below, 6 millimeters of mercury of PaCO2 will rise for every 10 milliequivalent rise in the bicarbonate. Now in this case, the bicarbonate has risen by 16. So an appropriate response of about 10 millimeters of mercury should be seen with respect to PaCO2 to term it as an appropriate compensation. Now, respiration alone won't fully normalize the pH because the body will not allow excess rise in the PaCO2. Because as the PaCO2 rises, the body immediately triggers compensatory mechanisms to wash it out and maintain its normalcy, thus preventing any further increase. Therefore, we may see an appropriate response, but the pH will not fully return to normal just on the basis of increased PaCO2. Now, the management of this disorder includes fluid and electrolyte correction, NG tube decompression, and infusion of normal saline and potassium repletion, which will correct the alkalosis component owing to the chloride. Surgical management is done with balloon dilatation or gastrojejunostomy. Now, if it is chloride responsive or not is checked by the urinary chloride. If it is less than 25, it suggests chloride responsive alkalosis, while more than 40 indicates a chloride resistant alkalosis. Thank you. Please like and follow.